Well, hi. It's been a little while since I've been on here. I'd like to say, well, I hope you all had a very good Christmas and are having a happy New Year. Um, Topic for today: Brexit medications and doctors refusing to prescribe medications that actually work for patients. As some of you are aware, I was in hospital for a while where I was being given injections for pain relief, and they were working very well due to the fact that the medication that I had been on is not available at the moment. I have been told that it's going to be due back on February the 9th, but that's not guaranteed. And after speaking to several people, it seems as though it's a problem due to the fact with Brexit. It looks as though medication is becoming a lot more difficult to get in this country, and the medications that they are getting, they're stockpiling at the moment. Anyway, back to the topic of pain relief. For the last few months, I have been left in pain and not been able to sleep. Now, I've spoken to my GP on several occasions about this, but he doesn't feel comfortable with prescribing some of the medications that the pain clinic suggested. Two of the painkillers that were suggested were hydromorphine and oxymorphine, which are extremely strong painkillers, but I've been told are quite reliable. I would much prefer to be on diamorphine tablets due to the fact that I already know that they work. At the moment, I've been put on morphine sulfate tablets on what I would classify as a very low dose, and that means that I'm not able to sleep. So 2 weeks ago, my GP referred me to a psychiatrist. I believe the purpose of him referring me to a psychiatrist was to try and get an opinion that I am a drug seeker. That didn't go quite as well for my GP, as the psychiatrist has turned around and said, I am not seeking drugs, that I am actually in real pain, and it's the pain that needs to be dealt with, and my GP needs to start dealing with it as soon as possible. I was supposed to come out of hospital a few months back, and until the diamorphine tablets were available, I was going to be giving myself injections subcutaneously, which means in the stomach or in the fatty tissues of the legs and arms. But my GP is refusing to prescribe that, so it means that it's leaving me in severe pain and not having any control. My GP has made it quite clear that even when the diamorphine tablets come back again in February, that he will not prescribe them to me, that he wants the hospital, my local hospital, should be prescribing to me. My local hospital has turned around and said it is not their responsibility to prescribe painkillers, it is actually up to my GP. So at the moment, there's a big argument over who should be prescribing them to me. Now, if they do come back on the 9th of February, I'm really hoping that my GP reconsiders. Just to let some of you know what's happened over the last few weeks, I informed my GP that I was going on a hunger strike until the pain relief was sorted out. Sorry, I do apologise, it's just difficult for me to talk sometimes with the pain. But yeah, I was going on a hunger strike. That started on the 23rd, so it was only a few days ago, which means that at the moment I'm not eating. I'm seeing my GP on Wednesday of next week, which will be, let me just double check the date, will be the 30th of January. And on the 30th of January, I'm going to be informing my doctor that I'm going to, accelerate the hunger strike, and I will be cutting down on my fluid intake as well. At the moment I'm drinking normally, but on Wednesday that will be going down to just 2 pints of water. At the moment I am drinking coffee, and it helps just the fact that I can have coffee, but on Wednesday of next week that's going to change, and I will be drinking just 2 pints of water per day for a week, and after that week it will be going down to 1 pint, and after the week after I will be stopping drinking completely. Now, some of you may think this is drastic, but I've got to the point now where, due to the fact that I'm going days and days without any sleep, and I am finding it difficult to move around and do anything. I don't eat properly. I'm not able to do normal household chores. I'm finding it difficult to even keep hygiene levels up, although I am trying my hardest. So because of all of this, I am taking the drastic action of the hunger strike, and increasing it, and I've already made the hospital aware, and several departments like the anaesthetic department, the pain clinic, the orthopaedic department, and the endocrinologist department, and also the cardiologist department. These are all departments where they have to deal with the pain, and they haven't been dealing with the pain. The hospital feel that I should be on diamorphine tablets, and I realise that due to the fact that diamorphine tablets have been unavailable, it means that they need to use something else for the time being, but they have not been willing to use the alternatives. GPs are too scared to prescribe opiate-based analgesia due to the fact that people have died on it, but there are some people out there that are in severe pain and need it, and I would turn around and say that I am one of them. So I would just turn around and say, just keep those in your thoughts, and I will keep you updated. I will do a weekly blog on this for the time being, but with the Brexit situation coming up, the medicine situation is going to get worse. I believe that coming out of Europe was not a very good idea. I realise that public opinion says that we should come out of Europe, but already some of the pharmacist companies are turning around saying that they will be pulling out of the UK if Brexit happens. We've already lost the medical advisory board for Europe. They have moved to Amsterdam within the last week, which means that 700 jobs have already gone. If Brexit happens and we get a no deal, then we are going to be in a situation where a lot more people are going to lose their jobs. 700 people is going to be just a small number of people that have lost their jobs. So I just hope that the government reconsider the situation with Brexit, and that we can either get a deal or the Brexit situation can be reversed. Because as a country we cannot survive without being part of an organisation, whether it be Europe or whether it be some other organisation where trading is going on. But if we don't sort things out soon, then things like medications are going to be yet but a small thing, because there's going to be other things that are going to start disappearing, and I believe that inflation in this country may increase due to the fact that we are going ahead with Brexit. But anyway, pain-wise, I just hope and ask that you keep me in your thoughts, and if any of you have any ideas about how to sort out the pain situation, how to get the doctors to agree to come to an agreement together, because at the moment there are doctors that are saying that I should be on certain medication, and then my GP started refusing to put me on those medications. So any ideas would be gratefully appreciated. Anyway, till next time, I hope to hear from some of you. Keep me up to date, and just let me know whether you've listened to this on YouTube or any of the other websites.